Hi guys, welcome to Nadin's Chit Chat on Nadin's TV. My name is Nadin, so it's not out of place for me to say Happy New Year. So today I'm with somebody that we all at Nadin's TV has been waiting for. It's because to catch Dr. Ma. Today I'm with Dr. Nma Holiday, a medical doctor, a health educator and advocate, and a social media influencer. I see that part. I like it.
I'm retired.
Retired from where? You catch her on social media. You know, doctors, we all know doctors to be very serious people. There's this part of Dr. Ma that if you catch on social media, you'll be shocked. Okay, today we'll be talking on cervical cancer, causes, symptoms, and the treatment. So last year, a research from World Health Organization made mention that cervical cancer is the second most frequent cancer in women in Nigeria. And it happens between the age of 15 to 44 year research from World Health. So today, Dr. Nma is going to educate us on cervical cancer. You know, a lot of people run away from that. Whenever you want to talk about cancer, people are like, don't talk about it. Though. I don't know if they are scared that if you talk about cancer, that you're going to
You know the
get
way
cancer.
Nigerian mentality is, where they
Yeah.
just tell you God forbid, it's not their portion, and all that. So that's why people don't like to talk about diseases. When you tell someone you have hypertension, here, God forbid,
It's not my portion. Dr. Nma, tell us what causes cervical cancer in women.
So cervical cancer is the, like you said, is the second most commonest cancer that occurs in Nigeria amongst women, and it's the cancer of the cervix. The cervix is the neck of the womb, that is the uterus. The womb is like this, in this shape. You see the vagina is the entrance. When it enters the neck, before you see the womb itself, it's the cervix. So that is what. So the cancer of the cervix is cervical cancer. The beautiful thing about cervical cancer is that
beautiful.
Yeah, it's preventable.
Okay.
That's what makes it like better than a lot of other cancers. That it's preventable. Like,
I don't want to swallow that part. That there's something beautiful. Okay.
We're just trying to be positive here. Okay. So the cost of cervical cancer, 99% cost, because there's the 1% cost. But the most popular that we talk about is the human papilloma virus. Which is sexually transmitted. So for someone who started having sex earlier, you're exposed to a lot of sex. You may be exposed to a partner that has the virus, yes, or you know your what is that song that said even your boo has a boo? You may have just one boo, and you're keeping
like 7 boos.
So the person may be a carrier and pass it, like transmit it to the female.
Okay.
So and then men are carriers. Not like they don't have human papilloma virus. They are carriers. It's just that they don't have a womb. They don't have a cervix, so they can't have cervical cancer. And the strain that causes cervical cancer is just like you remember on microbiology. You always have strain this, strain that.
Just I remember that part.
Even biology. So it's 16 and 18. So what, like I said, what makes it a positive thing is that there's vaccine available. So that's what makes it preventable. So if you have taken the vaccine, you're like, oh, I'm protected.
Okay, so doc, so from what age bracket can take that vaccine?
From the ages of 9 to 26, because it's expected that it's a child, like it may become sexually active,
of course.
Before you become sexually active, people is expected of them from 26 you become sexually active. But before you become sexually active, you should have taken the vaccine. But if you are already sexually active, you have to run some investigation. You get do a pap smear and check if you have changes or if you have the virus, and then if you do not, now take the vaccine. But it's expected that women after the age of from 30 to 49 should be doing pap smear to
Test. Okay.
yes, to look at their cervix and all. So
Doc, so aside the HPV, are there other causes of this cervical
yeah,
cancer?
well, for almost every cancer, you hear things like tobacco consumption, people that
Yeah.
smoke.
Mm-hmm.
So it's better we run away. Even on cigarette
They say
poster, you say you will die young,
they were
but
that young.
you see people that are still smoking, and you're like, what's going on in this department? Prolonged use of oral contraceptive with
Mm.
multiple pregnancies because you keep
Oh,
giving
okay.
churning out babies and
Okay.
early sexual activity,
Mm.
then a weakened immune system. Like HIV can weaken a one's immune system. So someone who has um, hu- human HIV virus in them
Mm.
is prone to developing cervical cancer more than someone
It
who,
doesn't have.
yeah. So,
Oh, okay.
but that 99% of the time is actually human papilloma virus that is the culprit. Then the 1% belongs to this other one. So that's why they
Okay.
say it's a preventable cancer.
Okay, now we've talked about the causes. What about the symptoms? What are the symptoms that somebody can see or notice to know that, oh, this is cervical
Um,
cancer?
okay, abnormal bleeding. Abnormal bleeding could be bleeding after sex, in between period, or someone who
Okay.
is menopausal have attained menopause. You
Mm.
know,
Mm.
suddenly start bleeding. Ah, kilo stop. What's going on? Then abdominal discharge that is foul smelling and
Okay.
even can have some colorations as well. Like you should call for worry, like you should go and see a gynecologist. Let
Mm.
them some people just go and take medications, like wrong health practices. Before you know it, you're finding out late. But when you notice changes like this
On
and see it
time.
and see a doctor, like
Mm.
this, in those days when there was still polio. There was this song they used to sing on radio. Kick polio and prevention is better
Better than
than
cure. Yeah.
cure.
Go
Go
immunize
immunize
your
your
picking. Yeah, I remember. I
picking.
remember.
So
Yeah,
you know,
that's
when
true.
you hear it every day, you know
Mm.
that prevention is better and
Than curing it, actually.
immunization is the key. Like finding out something early, it's the key. Um, so that's just it with that.
Mm.
Apart from the abnormal bleed, you also have pain.
Mm.
Some people can have pain
Okay.
during sex.
Mm.
Then they can also have symptoms like if it has advanced to the rectum because the cervix is close to the anus, that
Mm. Yeah.
place. Person can have or around that region. Like the person can have urinary symptoms because
Mm.
now that part is affected or difficulty opening bowel because that
Yeah.
the cancer has metastasized to that
Yeah.
side and it can present with the other symptoms, that is where it has gone to,
Mm.
you know, as well, because you're seeing a lot of things and you're like, what is this? So it may be that the cancer itself has
Yeah.
metastasized to other parts of the body, giving you such symptoms.
Okay, we've heard about the causes, the symptoms. So, what is the treatment? Is there any treatment for cervical cancer? Is there hope?
Um, treatment. Well, like I said, when you catch something early, if
Okay.
you do a surgery, like if it's still at the early, at that part, at that stage where it's just a change in the architecture or something, you can do a surgery. So, but treatment involves surgery, chemotherapy, which involves
Okay.
medication and radiotherapy as well. But that
Mm.
will be for you to see a an obstetrician and gynecologist who would see you and give you
Mm.
the adequate or the correct management of that disease. Do you understand? So the way cancer is, you can't say, this is, it doesn't have a cure. It's something you manage. So it's
Mm.
either you're doing surgery and removing the whole cancer cells, or you're doing radiotherapy and killing the whole cancer cells, or you're doing chemotherapy and killing the whole cancer cells, or they are doing this and they are telling you, and it depends. Management is also dependent on the stage of the
Okay.
cancer.
So the key is for someone to just know about it early enough.
Exact
If
early
you can, if you
detection is
can.
key, and prevention is better than cure.
So we've heard Dr. Ma that prevention is better than cure. It is better you check yourself on time. When you notice some changes and you're not comfortable with them, go and see a doctor. I beg. She said we should stop taking drugs at home on by herself.
But another thing, we should give kudos to Nigeria currently.
Okay.
Before
Hmm.
the human papillomavirus vaccine was not even part of the vaccinations or part of the immunizations, but currently it is, and I think
so
it's
kudos,
available.
Kudos.
I think it's available to children from 9 to 14 years, so they can go to any primary health center.
Is it free?
Yes, it's free for them.
So you see, it's free
for 9 to 14. Oh. Adults 26-year-olds, you don't buy your own, I think.
Okay, so for 9 to 14 years, you can go to any
primary health
care center and take the HPV vaccine, right?
Yes.
So prevention, as she said, is better than cure. It is better you know about it early, you prevent it, and then you can.
But if you can't access the vaccine, you can also, make arrangement or try to get it. Instead of buying bone street and buy.
now you're touching ladies where they don't want you to touch them.
So buying bone straight or if a guy is listening to this, it could also be a very good Valentine gift. So how can I forget Valentine is coming? How can I forget? It's a very good Valentine gift. Be like, babe, I want to take you to that.
Let me ask you, Doc. If you are a babe now, and I'm your guy, doing by the time I buy you HPV vaccine, what is it?
No. You be like, babe, like, adequate romantic like this.
Which kind of romantic is that?
You be like, babe, let's we need to go for a health check. So you first of all screen the person.
In this Nigeria.
Wait!
you tell your girlfriend to go for health check when you're not praying for marriage.
Wait now. If the person has not been, if you've not been sexually active before, you just go ahead and take the vaccine. But if you've been sexually active, you need to screen
check yourself.
You need to screen first. And if there's nothing, some people say you can take the vaccine. Maybe a 26-year-old babe, like, babe, let's do this. You go and do it. And if it's negative, be like, oh, let's go and take the vaccine. After taking the vaccine, it's like, I think you're meant to take like 2 doses. After taking the vaccine, you can now go out, have your lunch, have your other Valentine packages.
Okay. So guys, now don't hear me talk. Come off my mouth. Dr. Nma said for this year's Valentine, you should take your babe for a health check. Let me make it look nice. I'll be sound nice. Let me make it sound nice. Go for a health check. Of which one of the packages can be a HPV.
Yeah, after the screening, you can the person can go and take HPV vaccine and other vaccination. Then you can still buy the bone straight. It's important.
Very important. Very, very important. That part. Very important.
Let them not stole me from here.
Okay, thank you, doctor. Thank you for coming. So I think you've heard her. Please, prevention. I just went home with prevention is better than cure, because if you can prevent this, then what else? You can enjoy your life without stressing about contracting the virus. So thank you very much, guys. Stay glued to this channel. We'll keep on dishing out educational topics like this one. Now I just learned that they can give you HPV vaccine for Valentine. So stay with us. We'll see you in the next video. Bye-bye.